I want to thank our friend Kim Curtis for inviting us. It's an honor to be with you folks. Um, I met this lady at church many years ago. So, church is the foundation of our marriage, and it's a big part of our life. So, it truly is an honor to be with you folks tonight. Uh, we're going to be going over Medicare and individual, which is it's really great right now because it's open enrollment. A lot's happening, and we'll welcome any questions that you have. And again, I'm the vice president and she's the president, so I report to her. Take it over, President.
Hi, I'm Cindy. It's good to be with you this evening. I did put together a few little slides that Allie's going to put up there. So I thought I'd start off with just some glossary of terms that you're going to be hearing and seeing. And these pretty much right now, these pertain to individual health coverage. So ACA, which stands for the Affordable Care Act, was enacted by the government and President Obama back in March of 2020 to make it affordable for most people to get insurance. So it's also referred to as Obamacare sometimes as well. So it helps eligible consumers with subsidies, also called premium tax credits, and to help them lower the cost. Are you hearing me okay, Allie?
It's going a little in and out.
All right, so I'm gonna connect. So how the subsidies work, they're referred to as advanced premium tax credits. So if an individual can get lower monthly premiums based on their household income, and there's a calculator that is used in the marketplaces that are out there. So in addition to this being a brand new open enrollment for 2024, Virginia has decided to pull out of the federal health insurance marketplace and has created a state marketplace, and they call it the Virginia Insurance Marketplace. So it's going to work exactly the same as it's going to be an avenue for you to go and shop for plans and look at plan options and look at premium options, but it's just not through the federal avenue. It's going to be through a state avenue. So copay is a word you're going to see. So a copay is a flat fee that you pay at the time of service. Sometimes there's co-insurance, which is a percentage, and it's a shared cost after your deductible between what you pay and what the insurance carrier pays. And then, of course, claims, we all know what claims are. So they're typically submitted by your insurance provider, by the medical provider to your insurance carrier to get your medical services paid for. So when we talk about cost sharing, the individual that is insured shares in the cost of their medical care in addition to the insurance carrier that shares in the cost of the medical care, and that is through deductibles, your co-insurance, and co-pays. So on this sheet, you'll see where we talk about generic drugs. So drugs are defined, they're categorized in tiers. So you'll see tier 1, tier 2, all the way up to tier 6. So typically tier 1 and tier 2 medications are your generic medications and your lower cost medications. So if that's how you're going to keep your costs down, if your provider can give you a medication in those categories. So tier 3 and 4 are typically your brand name drugs. So they're going to have a higher cost when you go to get your medications filled. And then tier 5 and 6 drugs are specialty drugs, and they usually have the highest out-of-pocket costs for an individual. When you go look at health plans, whether you're looking at individual plans or group plans, they're categorized by metal levels: bronze, silver, gold, platinum. So bronze, the lower the metal, the higher your deductible, but lower costs. So your your platinum plans are your Cadillac plans. So they're going to carry the higher premium, but you're going to have a lower deductible, lower copays when you go get services, lower out-of-pocket costs. So right now, the open enrollment for individual is always this time of the year. So it's always November 1st through January 15th. If someone enrolls between November 1st and December 15th, then their effective date for coverage will be January 1st. If you enroll between December 16th and January 15th, then your coverage will be effective February 1st. So anybody that's eligible to enroll can go during open enrollment and enroll. It's not like it used to be years ago where you could walk into an insurance office and say, I want to talk to somebody about buying a health insurance plan. You can only do it during the open enrollment period, or a special enrollment period is a period of time outside of the open enrollment that allows individuals under certain circumstances to qualify to enroll in a plan. Those circumstances could be you moved into a new service area, you got married, you had a baby, or you lost coverage from an employer, or you were going through a divorce and lost coverage off of a spouse. You would have a 60-day special enrollment period to enroll in other coverage. So that's referred to as a SEP, or a special enrollment period. So out-of-pocket expenses to the individual is a combination of your deductible that you have to pay with most plans, your coinsurance or copays when you go have services, and then any services that you have that are not covered by your insurance provider are totally going to come out of pocket to you. So you want to stay in network in order to get the lowest cost of services to you. So you will see plan options referred to as HMO or PPO or HSA. And HMO stands for a health maintenance organization, and it's a managed care program. So the health insurer is going to manage your care. So by doing that, in order to keep the cost down, they're going to have a network of providers that have contracted with them to give you the lowest cost of service. A PPO plan enables you to use a doctor that may not be in that network, and it gives you the option to go out of network, but you're going to pay a higher deductible in most cases and higher out-of-pocket cost if you choose to do that. Now, you need to keep in mind, if you do go to an out-of-network doctor, that doctor does have the right to say, no, I'm not going to accept that insurance. And if that doctor says, no, I'm not going to accept that insurance, if you see that physician, you're going to be responsible for 100% of the cost. So networks are important, and it's important, so typically as a broker, your broker would be out there researching these doctors for you and helping you find a plan that's going to give you the lowest cost for the best care that you can get. So that's mainly the difference between an HMO and a PPO, is one gives you the opportunity to go out of network to see a doctor. The HMO, you are restricted to that network of doctors. If you go out of the network, period, it's not going to be covered. The other thing you're going to see, and I see this a lot when I'm working with Medicare, but star ratings. So the government created this star rating program, and it's a quality rating, and it's 1 to 5 stars, 1 and 2 being, overall low rating, 3 being average, 4 above average, 5 excellent. And the scores are based on member experience, medical care, and plan administration. So this is an easy way, and it was created for you, the consumer, to look at a star rating to find out, okay, how does this plan rate? So if you see a 1 or a 2-star plan, you'd want to, that should be a flag. You should question, okay, why is it a low star plan? So you're going to see that with individual health insurance, but more importantly, you're going to see it when you're looking at different Medicare coverages and different Medicare prescription drug plan coverage. So those star ratings are released every year. So that's just a quick visual to know whether or not you're dealing with a good plan or not based on consumers' feedback in the quality of medical care. So when I was talking about a special enrollment period, you have to have a qualifying life event. So that would be the determining factor as to whether or not you were eligible for a special enrollment period. Does anybody have any questions that I need on the terms that we just talked about? I think I covered. Oh, and so you'll see PCP out there. That's just referring to your primary care doctor. So that's the one that you usually go to see. Typically, when you're in an HMO plan, which is a health maintenance organization, your primary care provider is the one that should be managing your care, and they're the one responsible for referring you to specialists and for testing and whatnot. So they really should be in the know as to what what providers are in that network or within your insurance plan. So you should be able to use your primary care doctor as a gateway to help you get in the right area to be covered. Does that make sense? So another type of plan, instead of an individual plan, let's say you're leaving one job, but you have to be on a waiting period for 60 or 90 days before your new job's health insurance kicks in. You could look at an individual plan short term, or there's plans out there called short option plans. They don't cover pre-existing conditions. They don't cover medications. They're strictly in place in case of a catastrophic event to bridge the gap between one job to another. So you have some coverage in case you walk out and get hit by a car, in case you get in an accident. It's just catastrophic coverage. But it's lower out-of-pocket premiums for a short period of time. So it's another option to look at instead of COBRA that can be expensive, or an individual plan that could be expensive. Let's see, what else did I want to tell you? So, okay, HSA stands for Health Savings Account. A health savings account is bundled together with a high deductible health plan. So they're lower premium plans. Typically, you choose a high deductible. Nothing is covered until that deductible is met except for preventive care. So HSA plans are good options for especially young males that don't go to the doctor. So they don't want to pay a high insurance premium because they don't go to the doctor. But I don't recommend enrolling in one of those plans unless you're eligible, unless you're going to fund the savings account. So the whole point is, a lot of companies will offer a health savings account and they'll contribute an annual amount to your health savings account. But if you're not going to fund it, there's a maximum amount that you can put in every year. If you can fund it, then it actually is another retirement vehicle for savings, because that money stays in your account. If you leave the job, it goes with you. It's always yours. Whereas on the flip side of that, with a lot of large companies, they offer FSAs, which is flexible spending accounts. Sometimes they fund those, sometimes they don't. You can fund those through payroll savings, but it's a use it or lose it by the end of the calendar year. So That's why a lot of people are scrambling in November and December to get their eyes checked, buy their glasses, do whatever. So that's the main difference between those two plans. They're both saving mechanisms, but one is yours to keep regardless, and the other one you use it or lose it. Does anybody have any specific questions regarding individual coverage before we switch gears? Nope. Okay. So the other open enrollment that's going on right now is literally with Medicare. So it's actually called the annual enrollment period, AEP. You see all the commercials on the TV, call this number, you can get money back on your Part B premium. Call this number, you can get dental, vision, hearing. So basically, when an individual turns 65, they're eligible to enroll in Medicare if they choose. So Medicare has 4 parts. Well, actually 3 parts, and then there's an extra part. So Medicare A is your hospital coverage. Somebody that has worked their 10 years or 40 quarters, it's premium free. It doesn't cost anything. Part B is the medical portion of Medicare. That does have a premium. Medicare sets that premium annually every year. Part D is a prescription drug plan to cover your medications. And Part C is a Medicare Advantage plan. So when you turn 65 and you're looking and figuring out if you want to do Medicare or not, or what your needs are, if you're on Social Security and collecting benefits, Medicare is going to automatically enroll you in A and B and mail you your Medicare red, white, and blue card 3 months before you turn 65. If you are working and on a group health plan, you don't want to enroll in Part B because that could jeopardize an open enrollment period to get onto a Medicare supplement, and we can talk about that in a minute. So if somebody's actively working covered under their group health plan, they need to determine whether or not it's feasible for them to come off and go on Medicare. Would that save them money, or are they better off staying on their group plan? And if so, they can stay on their group plan. They don't want to enroll in Medicare Part B because it's going to mess up open enrollment for them down the road. If somebody is on a group plan and they're contributing to a health savings account and they don't have any intention of retiring anytime soon, they don't want to enroll in either A or B, because then they could be in a penalty situation when it comes time to enroll. There's strategic things that you have to look at before coming off of a group plan while contributing to an HSA. So just know that and get advice from someone in regard to figuring out when you need to come off the plan before enrolling in Medicare to avoid a penalty there. So if you make the decision that, yes, I want to enroll in Medicare, now I need to figure out what other coverage I need. At the bare minimum, to avoid any penalties, you want to do A, which is hospital, B, which is medical, red, white, and blue card, and a prescription drug plan to avoid any penalty situations. But Medicare only covers 80% of your medical needs, the medical costs. So you need something that's going to fill in that 20% that Medicare doesn't cover. That's where you either do a Medicare supplement or you do a bundled plan, which we refer to as Medicare Advantage or Part C. So that's what all the commercials are offering that you see on the TV. They want you to purchase a Medicare Advantage plan and it actually replaces your Medicare, because your Medicare benefits are embedded in that plan along with Part D and drug coverage. And they also offer added extra benefits like dental, vision, hearing, grocery benefits in some cases, over-the-counter benefits in some cases. There again, you got to pay attention to networks and make sure that doctors you are seeing will accept the particular Medicare Advantage plan you're looking at. So it's important to research your doctors. It's important to research your medications. It's important to look at the different value-added benefits, because each carrier has different networks for their dental plan, their vision coverage, their hearing coverage. So it's important to break all of that out and determine what your needs are. So that's where it's beneficial to have an advocate in your corner that's going to help you do a needs analysis and figure it out exactly what you're looking for, what's in your budget, and that sort of thing. What else? Oh, this is just a flow chart I made. Okay, so this is a lot of information, and basically it's all about enrollment timelines. So there's an open enrollment right now for individual. There's an annual enrollment right now for Medicare. The annual enrollment it just pertains to somebody that wants to change their drug plan or wants to change their Medicare Advantage plan or enroll in a Medicare Advantage plan. Anybody can do that between these, October 15th to December 7th every year is the Medicare annual enrollment period for anybody for anybody that's on Medicare. So anybody that's on Medicare A and B can enroll in a Medicare Advantage plan and can enroll in a Part D drug plan during the annual enrollment period. Outside of that, if you miss that opportunity, the next opportunity to enroll in Medicare, well, all right, let me back up. If you don't enroll in Medicare Part B when you are first turning 65, if you miss, the initial enrollment period is 3 months before you turn 65, the month you turn 65 to 3 months after. So it's a 7-month window that you can enroll in Medicare when you first turn 65. If you're working and have credible health coverage elsewhere, you don't need to enroll in Part B. But if you miss that enrollment opportunity that you should have enrolled during your initial enrollment period, the next opportunity is not until the general enrollment period, which is January 1st to March 31st every year. And then depending upon what month you enroll, your effective date would be the first of the following month. It used to be, my chart needs to be updated a little bit. It used to be that if you enrolled during the general enrollment period, January 1st to March 31st, you'd have to wait for an effective date of July 1, which really was causing hardships on individuals because they had to go that whole 6-month period without coverage, and then that made their penalty more. So if somebody misses the opportunity to enroll in Part B when they should have and didn't have other coverage, they're subject to a penalty, and it's a lifetime penalty. So it's 10% penalty for every 12-month period you could have had Part B and did not. So that can add up. Same thing with prescription drug coverage. Part D came into fruition in 2006. So if somebody did not enroll in a drug plan, a prescription drug plan with Medicare when they were first eligible, then anytime during the annual enrollment period that October 15th to December 7th, the penalty is assessed based on every month that you could have had Part D and didn't. So Part D penalty breaks it down by months, each month. So it's a nominal fee, but they take a nominal average and it's like 33 cents a month for every month that you could have had drug coverage and did not. So in some cases, I've had clients talk to me and say, okay, well, I'm 81 and I've never had Part D. Well, my counsel would be don't enroll in a plan that has drug coverage because you're going to be assessed a penalty, and it's a lifetime penalty that's going to be added to your premium forever and always. So this is just showing you the different enrollment, just the different enrollment timelines and the different periods and what to do and when to do. And so I use this for financial planners because they're guiding their clients on these types of things. But, you know, it is valuable information and it does help a lot. Yeah, those are just notes. Yeah, because I kind of just went over all of that. But so when you're looking at whether do I want a Medicare Advantage plan or do I want a Medicare Supplement plan? With a Medicare Supplement, it's government designed, so they're standardized, but they're offered by private insurance carriers. So the insurance company makes the rules. So the insurance company says, you have a 6-month open enrollment window from your Part B effective date to enroll in a Medicare Supplement, no questions asked. It's guaranteed coverage. You don't have to answer one medical question and you have coverage. And then if you chose that route, you definitely want a separate drug plan. So you'd have Part A that doesn't cost you anything. You have Part B that does have a premium, and right now that premium is $164.90 in 2023. It's going to $174.90 in 2024. Then that's per month. If you're drawing Social Security, that premium's coming out of your Social Security check automatically. If you're not on Social Security, Medicare is going to bill you quarterly for that Part B premium. Then you would have a Medicare Supplement premium. That premium is based on your age when you go into the plan. The carriers look at their book of business every year and may make an adjustment, but your premium will go up based on your age when you get older and any adjustments the company may make. And then you'd have a separate policy for Part D. Or a Medicare Advantage plan bundles all that together. So it actually replaces your Medicare, red, white, and blue card. So you're going to tuck that away. You don't lose it. The plan has all the benefits of your A and B. And then a lot of the plans have your prescription coverage all bundled up in one plan, and then offers you the dental, vision, hearing, groceries, over-the-counter benefits, all of these value-added extras. Well, because it's a bundled plan, most of the plan offers are HMO plans. So therefore, that network that I talked about earlier is very important, because with a Medicare Advantage plan, you must go to a provider that will accept it. With a Medicare Supplement plan, you can go to any doctor, any facility nationwide that accepts Medicare, and it's portable. So if you move out of the area, it goes with you. It stays with you. You don't have to make a plan change. With a Medicare Advantage plan, you have to stay in the service area and you have to go to network doctors. So that means medical network doctors, that means dentists that are in the network, vision provider that's in the network, hearing provider that's in the network. I mean, they're making the rules because they're trying to keep costs down and keep your premiums down. So typically a Medicare Advantage plan are zero premium, most of them, and you pay copays and coinsurance when you use it. And they usually set a maximum out of pocket, meaning once your copays, deductibles, et cetera, adds up to a certain threshold amount, then you pay no more for your medical care for the rest of the year. It's the same thing with group. Group has maximum out of pockets. Individuals have maximum out of pockets also. If you have someone that can help you through that, it would benefit you. That's what agents and brokers are. That's why we do what we do. It doesn't add any cost to your coverage. The brokers are paid a commission by the insurance carrier. That's how they get paid. So I would not shy away from asking someone professionally to assist you, because it would benefit you immensely. It would help you cut through all of the confusion and reading and stress. I mean, I know I deal with clients all the time, and I said, I'm going to break it down. We're going to take baby steps. Here's what you need to do first. Here's what you do second. And yeah, I highly recommend everybody have an insurance agent as their advocate.